LASIK, or laser-assisted in situ keratomylosis, was first performed in 1991 and has continued to evolve over the years. LASIK simply means to shape the cornea within using a laser. Several years before LASIK, surgeons treated the surface of the cornea with a procedure called photorefractive keratectomy, or PRK. Although PRK is still an excellent procedure, surgeons discovered that treating the inner tissue of the cornea offered patients less post-operative discomfort and a quicker return to functional vision. LASIK surgery is routinely performed on millions of patients every year. But no matter how often it is performed, there is always the potential for side effects and complications. Ultimately, only you can make the decision to have LASIK. And that decision needs to be based on your knowledge of both the risks as well as the benefits of the procedure. LASIK is considered an elective procedure. After all, you could just continue to rely on glasses or contact lenses to correct your vision. There may also be other types of surgery that could correct your vision that are available now or in the future. Conventional LASIK treats the optical errors associated with nearsightedness, farsightedness, and astigmatism. Custom LASIK treats additional types of optical errors called higher-order aberrations, using wavefront measurements to further improve the overall quality of vision. The procedure is performed on an outpatient basis. As the eye is easily numbed with eye drop anesthesia, you should be quite comfortable during the procedure. First, a corneal flap is created using a femtosecond laser. It makes the flap by placing microscopic bubbles at a precise depth within the cornea to separate the layers. This method is considered more precise and avoids the occasional serious complications that can occur with incisional flap creation. LASIK involves removing corneal tissue under the LASIK flap to correct the focusing power of the cornea. How much corneal tissue is removed and the length of the laser treatment depends on the amount of correction needed. Treatment times can range from only seconds to a minute or so. The flap is then returned to its original position where it bonds without the need for sutures. After the procedure, you will be given instructions about any special medicines or treatments that will help the healing process. It is important that you follow all instructions and come in for all follow-up appointments. You will need to have someone drive you to and from your procedure. After the procedure, it's best to go home and get some sleep. Because it is possible to dislodge the corneal flap in the early post-operative period, it's important that you do not rub, push, or squeeze your eye. You may be instructed to wear the eye shield to bed for a while. Also, when you are involved in activities where your eye could be accidentally hit, you should wear some type of protective eyewear. Most people resume their normal activities in a day or two. For the first 24 to 48 hours, you may feel some scratchiness in your eye. This will cause some tearing and minor discomfort, but this will rapidly improve. Discomfort can often be taken care of with over-the-counter pain relievers and lubricating eye drops. If you experience pain that cannot be relieved by medication, you should call your doctor. How well a patient sees immediately after surgery varies quite a bit from one person to another. Some patients see improvement in their vision immediately after the procedure. For others, vision may be blurry and fluctuate for several days to several weeks, or occasionally longer, especially if they're being treated for farsightedness. Both eyes are often treated on the same day. However, should you have just one eye treated at a time, you may experience an imbalance between your eyes. This could impair your ability to work and drive, unless temporary glasses or contacts are used to minimize the refractive error between your two eyes. The goal with LASIK is to improve your functional vision by reducing or eliminating your dependence on corrective lenses. However, it does not always create 20/20 vision, and your doctor will not guarantee this result. In fact, not all eyes are even capable of seeing 20/20 or better, even if you are considered an ideal candidate for either conventional or custom treatment. It is also possible for your vision to measure 20/20 when tested, even though your vision is not perfectly clear. But the good news is that the vast majority of people who have LASIK are able to pursue the normal activities of daily living without dependence on corrective lenses. If you do still require correction after the procedure, the lenses in your glasses will usually be thinner and more attractive than the ones you probably are wearing now. In the rare event that you will want to wear contact lenses after LASIK, you should be able to, though in rare cases, this may not be possible. If your eye is overcorrected or undercorrected by the initial procedure, it can often be retreated with additional surgery, but not always. Some patients may also experience an excellent initial result, only to have the effect diminish over time. In some, but not all cases, retreatment can help. Even in unoperated eyes, vision tends to diminish over time due to the natural aging process. Everyone who has both eyes corrected for clear distance vision using any technique, whether it be with glasses, contact lenses, or laser vision correction, experiences difficulty with their near vision if they're over the age of 40 to 50. This loss of near vision is due to a condition called presbyopia, or aging of the eye. Around ages 40 to 50, the lens inside the eye becomes stiffer and loses its ability to change shape, which allows you to shift your focus from distant objects to near objects. Although before surgery you may be able to take off your distance glasses or contact lenses and see well up close, after surgery there will no longer be any glasses or contacts to take off. So, if you're over 40 to 50 years old and have both eyes corrected for distance vision, you will need to wear reading glasses for near vision. If you are in this age range and you want to be able to see clearly both near and far, you may want to ask your doctor about the possibility of treating your dominant eye for distance vision and your non-dominant eye for near vision. Your brain automatically selects the image you want to see, providing you with clear vision at all distances. This is called monovision or blended vision. Although this type of blended vision is well tolerated by many patients, it may not be right for you. Almost everybody experiences some degree of visual side effects for a time after surgery. You may be more sensitive to light, and you may see glare and halos around lights, especially at night. Although they are usually mild and temporary, there is the possibility that they may not go away completely. However, newer laser software that allows for a larger treatment area and the introduction of wavefront treatments have demonstrated significant improvement in the quality of nighttime vision after laser vision correction. But at night, many people, whether they have had laser vision correction or not, experience a slight blurring of vision, especially if they have wide pupils. People experiencing this condition may find they need to wear corrective lenses to fine-tune their vision for nighttime activities such as driving. Do not drive until you are certain your vision is adequate for driving. Additionally, your eyes may feel drier after the procedure, and artificial teardrops may be needed for several months, or even permanently, to relieve this condition. Your doctor may recommend other alternatives, such as taking fish oil omega-3 pills, or recommend a variety of other treatments to further reduce dry eye symptoms. You should also be aware that some patients have actually lost several lines of best corrected vision. This means if a person were able to read the 20/20 line with their glasses before the procedure, they may not be able to read the 20/20 line with glasses or contacts after the procedure. This loss of best corrected vision can be due to scarring, decentration of the treated area, and irregularities in the surface of the cornea. There's also the remote possibility of infection, drug reaction, or other rare occurrences that could cause loss of vision or the need for a corneal transplant. It is also possible that you could have a degenerative corneal disease, such as keratoconus, which can affect your vision in the future. Keratoconus in its early stage is difficult to detect, and because it can develop on its own, there is no test to guarantee you will not develop it after laser vision correction. Additional very rare complications can include corneal swelling, corneal thinning, appearance of floaters, retinal detachment, hemorrhage, retinal venous and/or arterial blockage, and cataracts. It is also possible that before or during the creation of the flap or during the laser treatment, the equipment could cease to work properly, causing the procedure to be stopped or postponed to another day. Please understand that it would be impossible to cover all known and unknown risks that have occurred in the past or could occur in the future in a program such as this. However, LASIK has been performed since 1991 and has shown good long-term stability. Millions of people all over the world have had laser vision correction, and the vast majority of patients are able to pursue the normal activities of daily living without dependence on corrective lenses, and have found their results to be extremely satisfying. Now, let's try a short 10-question quiz to see how well you understood the information in the program. Please circle true or false on your answer sheet. 1. True or false? LASIK will permanently change the shape of your cornea. 2. True or false? There are no guarantees as to exactly how well you will see after the procedure. 3. True or false? You may experience side effects such as haze, glare, halos, light sensitivity, and dryness of the eyes that may not go away completely. 4. True or false? All eyes are capable of seeing 20/20 or better. 5. True or false? After the surgery, follow-up visits are not important. 6. True or false? There is the possibility that another operation may be necessary after the initial procedure to obtain the best level of vision correction. 7. True or false? It is possible that you might still need to wear glasses or contacts, or that LASIK could cause loss of vision. 8. True or false? You may experience mild to moderate discomfort for several days after the procedure. 9. True or false? LASIK will eliminate your need for reading glasses when you're over 40 years of age or presbyopic. 10. True or false? The program that I watched covered all risks, side effects, and complications that could possibly occur either now or in the future with LASIK. When you have completed this quiz, please grade your own test by comparing your answers to those found on the bottom of the page. You will also be given a written informed consent that covers additional information regarding risks and complications. Please read this document thoroughly and have all your questions answered by your doctor or a staff member before signing this document. Don't rely just on this program to make your decision whether to have the procedure. If you need additional information or would like to watch any segment of this program again, please ask a member of our staff for assistance. Thank you for your trust and confidence in choosing our clinic for your vision correction needs.